According to the World Health Organization, published in 2018, there were 1 in 10 babies born premature, which is before 37 weeks. We all know someone who was born premature, or was that someone who was born premature. My cousin had twins who were born early, and they were born about 21 weeks old, and they came out of the womb and went straight into the NICU. However, they did not make it because they were not able to live and function out of the womb by themselves. Today, I will tell you about neonatal nursing. I will discuss what neonatal nursing is, how to become a neonatal nurse, and what levels of neonatal nursing there are. Now, what is a neonatal nursing? According to the All Nursing School, which I viewed on September 30th, neonatal nursing focuses on the care of newborn infants, many born premature, or with serious health problems. Now, the babies develop their lungs very last, so there's a very critical period between when the lungs start to develop and when they're born. So you really would like your baby to be born at the 37 weeks, but some are born premature. So this is where the neonatal nurses come in, and they have to help that baby breathe on their own. And so now that you know a little bit about neonatal nursing, I'm going to tell you how to become a neonatal nurse. So you're required to have at least a 2 years associate's degree. They would prefer you to have a 4-year BSN, which is a Bachelor's of Science in Nursing degree, and you have to have a RN, which is you have to be a registered nurse. Now let's look at the different levels of neonatal nursing. According to the Rocky Mountain Hospital, which I viewed on September 30th, for children, there are 4 different levels of NICU, which is the Neonatal Intensive Care Unit. The first is a basic level. They are healthy babies. They're born full term. They're very healthy. They just have to go in there and be checked, and then they can go home with their family. The second is the Advanced Newborn Care. They are 32 weeks or more. They just have a serious health condition. It can be very minor, but they just have to stay in there for a couple days, and then once they're better and doctors and nurses know what's wrong, they can be sent home. The third is a subspecialty newborn care. They're less than 32 weeks. This is where it gets iffy with the lungs, and they have critical illness. So usually they come out of the womb and they have to be put in an incubator. This incubator holds them tight like they're in the womb still, and it keeps them warm. So their body isn't working extra hard to keep their body temperature up, and the feeling of the womb helps them not stress. And too much stress can not let them heal faster and get better faster. Then the 4th unit is like the severe unit, and this is where they have surgical repair. If anything's wrong with the heart, they go straight to that unit and they have surgery, so then they can live on their own. These are the very critical babies, and we don't want the critical babies, we want the healthy babies. So they start off at the critical and then they work their way up until they can go home. Today I informed you about neonatal nursing. I told you about what neonatal nursing is, how to become a neonatal nurse, and the different levels of neonatal nursing. With the odds of 1 in 10 babies born premature, you have good odds in having a NICU baby.